My name is Peter Kokinas, Professor of Medicine at Georgetown University School of Medicine and the Director of the Human Performance and Research Lab at the Veterans Affairs Medical Center in Washington, D.C. The title of the article is Cardiorespiratory Fitness and Incidence of Major Adverse Cardiovascular Events in Veterans, a Cohort Study. It will be published in the January 2017 issue of Mayo Clinic Proceedings. The purpose of this study was to assess the association between exercise capacity or cardiorespiratory fitness and the risk for developing major adverse cardiovascular events or MACE. MACE was defined as the initial occurrence of myocardial infarction, fatal or non-fatal, congestive heart failure, coronary artery bypass graft, or stroke, fatal or non-fatal. Our cohort consisted of 20,590 U.S. veterans from Veterans Affairs Medical Centers in Washington, D.C. and Palo Alto, California. Cardiorespiratory fitness was assessed by a graded exercise test and expressed in metabolic equivalents, or METs. Based on the peak MET level achieved and the age of the participant, we established the following 5 fitness categories. 1, least fit, MET level 4.3 plus or minus 1.2. Low fit, a MET level 6.0 plus 1.2. Third group, moderately fit, 7.3 plus or minus 1.2. Fit, 8.8 METs plus or minus 1.4. And 5, highly fit, 11.8 METs plus or minus 2.9. Multivariate Cox proportional hazard models were used to estimate risk for developing MACE across fitness categories. The models were adjusted for age, BMI, race, and other known cardiovascular disease risk factors and medications. Our findings: during a median follow-up of 11.3 years, there were 2,846 MACE events, with an average annual incidence of 11.6 events per 1,000 person years. The MACE Fitness Association was independent, inverse, and graded. The risk for developing MACE was 16% lower for every 1 MET increase in exercise capacity. When considering fitness categories, the MACE risk decreased progressively as fitness status increased. Compared to the least fit individuals, the risk of MACE was 30% lower for low fit and progressively declined to 68% lower for individuals in the highest fitness category. The impact of cardiorespiratory fitness on the incidence of MACE was similar for blacks and whites and for those less than 60 or equal to greater than 60 years of age, to account for the possibility that the higher rates of MACE observed in the low fitness category was the result of low fitness and not underlying cardiovascular disease, a phenomenon known as reverse causality. We excluded those who experienced MACE within the initial 3 years of follow-up and repeated the survival analysis. The Cardiorespiratory Fitness MACE Association remained robust, and the risk reduction did not deviate substantially from that observed in the entire cohort. Our findings support that increased cardiorespiratory fitness protects against the development of MACE. Thus, cardiorespiratory fitness assessment in clinical setting is of great importance and should become part of the patient's evaluation. Failure to consider cardiorespiratory fitness status in routine clinical practice is likely to result in a suboptimal risk stratification of the patient. It is noteworthy that the average peak exercise capacity necessary to lower the risk of MACE in this cohort was just 6 METs. This level of fitness is achievable by daily brisk walks. We strongly recommend brisk walking because it is the safest, most effective, and inexpensive way to increase fitness and improve health. Individuals should start slowly, even as low as 10 minutes each day, and add 1 to 2 minutes per session at the end of the week. The goal is to accumulate a total of 150 to 200 minutes of aerobic activity each week. Scientific evidence supports a strong link between cardiorespiratory fitness and human health. Therefore, future research should focus on finding practical and inexpensive ways which will enable routine evaluation of cardiorespiratory fitness status and general clinical practice. The take-home message of this study is that moderate exercise, such as walking briskly for 30 to 40 minutes 4 to 6 times per week, is safe for almost all ages and health conditions and can significantly lower the risk of developing MACE. Thus, we recommend that healthcare providers advise their patients to engage regularly in daily brisk walks. It is also important to emphasize that physical activity is associated with some risk of injury and even death, especially in sedentary individuals. However, the risk of physical inactivity is far greater than that of physical activity. To reduce this risk further, all individuals with any cardiovascular risk factors must consult their physician prior to initiating any exercise program. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.